This is Dr. Daniel Paul, orthopedic surgeon with Easy Orthopedics, and today I'm going to talk about how you can tell if you broke your hip. So I'll just say that if you broke your hip and you really broke it, you're not going to be able to walk. You're probably going to be lying on the ground in excruciating pain, and you're either going to be calling an ambulance on the way to the hospital, or you'll be having that thought in your head. So generally speaking, there are a few exceptions, but generally speaking, when someone breaks their hip, it's not like a question of whether you did it or not. Like you're down for the count and pretty much have to go to the hospital. Most of the time you see hip fractures in two populations. Generally it's in elderly, older people. They'll kind of get the hip fractures where they're kind of walking around, they take a misstep and they break their hip and then they're down. And then you get it in a younger population. Usually it's not easy to break your hip, but it's like usually high trauma activities like car accidents or that sort of thing that can cause a hip fracture. Now there are a couple caveats. Sometimes usually when you break your hip, it displaces a certain amount. You can break your hip or the femoral neck where it doesn't move too much and it's non-displaced, but if you do that, you'll still have very significant growing pain. And there's also stress fractures that people can get of that area as well. If, like, let's say, usually in the female population, younger, like training for a marathon, can start to get a lot of growing pain. That can be a question if you might have broken it where it didn't displace it too much. That's more of a stress fracture. The other weird sort of hip fractures are sometimes you can get fractures of the kind of outside the hip joint, the greater trochanter. It's rare. That is something you can walk on. That's more of pain on the side of the hip. But most of the time, if people have pain on the side of the hip, it's actually hip bursitis. But by and large, if you're wondering if you broke your hip, if you're running a lot or doing that sort of thing, it's possible you have a stress fracture. Otherwise, if you're on the younger side, you need some tremendous amount of trauma to break it, and you'll know mostly all the time. If not, and you're really concerned about it, you can go to the doctor and get an x-ray. That'll pretty much always tell you, unless it's a stress fracture, in which case you need an MRI. But honestly, most of the time when people break their hips, they know. So I hope I was able to answer your questions about how to tell if you broke your hip. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But note that I can't really talk about your specific medical situation or give you medical advice about what you should do. If you like this video, we put out new content every week. So please like and subscribe, and thanks for watching.